and I was sitting out there just visiting. I'm going to break from protocol. Chief Baker, just a minute. I'm going to have Chief do our invocation.
Our gracious Heavenly Father, let's thank for this day that we can come together in the service of the Cherokee people to promote and the culture, the heritage, the history of the Cherokee people, and to pass budgets that serve those needs. Bless each and every one of the counselors here, guide and direct them, and give them the strength. In Jesus' name we pray. Amen.
Amen.
Shelley, let's do roll call. Yes, ma'am. Denise Taylor.
Here.
Keith Austin.
Here.
Neil England.
Honey.
Harley Buzzard. Bill Burr.
Honey.
Sean Crittenden.
Honey.
Mike Dobbins.
Here.
Frank Targus. Wanda Hatfield. Max Jordan.
Here.
Dick Lay.
Here.
Mike Shambaugh.
Here.
Mary Bakershaw.
Present.
Leo Smith.
Here.
Victoria Vasquez.
Ami.
David Walkingstick. Brian Warner.
Honey.
All righty, very good. Okay, we only have one item on our agenda today. Councilor Austin?
I'd like to put the proposed budget in the form of a motion.
Second. Okay, the co-chair of ENF is ready to go, came to work today. So we have Councilor Austin with a motion, Councilor Vasquez with a second. So with that, I just want to let Lacey go ahead with an overview, and we'll just go ahead and get started.
Good morning, Madam Chair, Mr. Speaker, and Tribal Council. Good morning. It is an honor to be here before you today to present the Principal Chief's proposed budget for fiscal year 2018. I have prepared a presentation for you to give you an overview. I will walk you through the revenue assumptions, budget presentation process, updates relating to the budget, and employment information. I will make this presentation in full and take any unanswered questions you may have at the very end. Thank you in advance for your attention. Now let's begin. This is the Cherokee Nation 2018 budget presentation for the Principal Chief's proposed budget, presented by me, Lacey Horn. FY18's budget consists of 24 departments. Departments include tribal government, service departments, resource departments, and boards and commissions. The numbers assigned to each department will correspond to your white budget books. As you can see, the number of departments are not consecutive, as we do not have departments with numbers 16, 21, or 22 in this budget.
Lacey, can we make that clear?
You have this in front of you as well.
Yeah, thanks.
Now we will look at a screenshot of the proposed comprehensive budget. The comprehensive budget consists of an operating budget of $647.6 million and a capital budget of $246.7 million for a combined total comprehensive budget of $894.3 million. Now I will take you through the revenue assumptions. The 10-year tables you will see are consistent with those that have been presented to Tribal Council in prior years. This table gives an overview of General Fund, which is the primary topic of Council's discussion today. The green line reflects budgeted sources and includes tribally funded sources of revenue, including business dividends and tax revenues. The blue line reflects budgeted uses, and the purple line is the net position. In this proposed budget, all general fund sources have a corresponding use. This table shows the trends in grants, compacts, and tribal revenues. Grants and compacts revenue, the blue line, shows a reduction of $4.8 million. This is due to multiple small grants ending in FY17 and FY18, such as the Cowie Cafe and PrEP, as well as reductions in available carryover and federal budget concerns affecting some of our programs such as NAHASDA and substance abuse. As previously discussed, federal budgets could change dramatically once the FY18 federal budget is approved by Congress. Tribal revenue, the green line below, decreased $35 million as a result of a $9 million decrease due to the capital budget spend down related to the second floor and roof of the tribal complex being nearly complete, a $21 million decrease as a result of the work on the joint venture construction project, an $8 million reduction in debt, offset by an increase of $3 million to tribally funded programs to maintain current service levels. Tax revenue includes motor fuels tax, tobacco other tax, and motor vehicle taxes. Estimates for FY18 include $7.9 million in motor fuels tax, $13.9 in motor vehicle tax, and $16.4 in tobacco other tax. Motor fuels tax, the green line, will remain flat with prior year. The motor vehicle tax revenue, the purple line, sees a continued increase as a result of the tag compact with the state of Oklahoma being expanded statewide. Tobacco tax revenue, the blue line, will see a decrease due to the rebate from the state being reduced from 65% to 55% in 2018. This table gives a trend analysis for dividends from component units. Dividend revenue estimates for FY18 remain flat with FY17. As such, the dividend estimate for this year is $45.5 million. The next two pie charts give an overview of funding sources for the comprehensive budget. This table gives you a complete breakout of funding sources both federally by agency and tribally by type. IHS is our largest source at 33.1%, and capital projects is our second largest at 16.7%. And this is mainly due to the funds available for the Tahlequah joint venture project. This table gives you the high-level overview. Federal funding of our budget is 59.6%, tribal is 33.7%, and tax is 6%. Now we'll take you through the process of arriving at the proposed budget. This is an intensive process that takes several months to complete, so let's take a look. The FY18 budget planning process began in April of 2017. The Budget's office sent an email to the departments on April the 13th. Departments were given the direction to prepare a flat budget consistent with FY17. The indirect cost or overhead rate used is 13.1%, versus 11.85% in FY17. The fringe rate applied to full-time employee salaries remained flat for FY18 at 33.6%. Programs were given 5 weeks to ready their proposed budgets that were due back to the Budgets departments on May the 19th. Departments were required to provide detailed descriptions of each program, including intended outcomes, measures of effectiveness, and success rates for each program. We also asked them to tell us who is eligible for their program, what is their service area, and how many participants they serve. They were asked to detail any significant changes in staffing patterns. They were also requested to provide information on external funding or grants that the program researched and/or received. And finally, we asked for information on the external entities with which the programs collaborate. These detailed narratives for each program can be found in your budget books. Review of the budget continued in June into July by the Budget Review Group using several focal points. We first began ensuring that programs were funded based on priority of their service objectives. Programs were then evaluated to see if they could utilize grant dollars instead of using general fund dollars, and also the program's willingness to seek out and apply for grant dollars. We also reviewed any correspondence from their federal funding agencies to consider any changes to their programs. We asked the questions: had the program previously received one-time funding? What is the current and past usage of funding? Were there any auditor findings or concerns, and how can we apply best practice accounting? And finally, what is the rationale behind any budget increase requests? After the financial review was completed, the budget was reviewed by Chief and Administration. After final adjustments and compilation, the budget was submitted to Tribal Council as required by the Cherokee Nation Constitution. That concludes my process for the budget preparation. And now I'd like to mention a few matters within this budget. The operations of the Tribal Historic Preservation Office are currently being funded by the general fund, pending notification of a renewal grant award. Once the award documentation is received, if funded, the program will be moved back to a grant fund budget. Revenue proceeds for this program are reserved in a grant-funded budget, which will be included as a component of Exhibit A. The Housing Accessibility Pilot Program will be transferred to the Housing Authority to continue assisting emergent housing needs, and funds will be reserved by Tribal Council district pools. After 4 years of negotiation with the Interior Business Center, it was determined that registration will no longer be funded by the indirect cost pool for FY17 on. Registration had been included in our indirect cost pool for 25 years. The agency reversed its interpretation regarding these costs. The program is now funded by grants and the general fund. And I would like to add that these negotiations staved off an agency determination for 4 years and saved the Cherokee Nation over $4 million in general fund. Also, the Marshal Service contract with C&E will be expanded in FY18, which will shift the portion of their budget funded by NAHASDA to general fund. As part of the initial grant agreement to fund the Cowie Cafe, Cherokee Nation committed to operating this restaurant training program with general fund dollars after the grant expired. As such, there's a 1-year pilot budget for the Cowie Cafe included in the FY18 budget. Carryover funds were included in this budget to balance the general fund. A surplus of dividend carryover and BIA contract support cost settlement funds were brought in to fund programs, and a portion of these funds will need to be carried forward into FY18 and 19 as needed. The cash reserve account is budgeted at full legal compliance consistent with Legislative Act 5-02 and all subsequent amendments. This holiday, the Cherokee Nation places an emphasis on water and reminds us that water is sacred. I would like to draw your attention to the fact that Cherokee Nation is investing $8 million in tribal and grant funds towards our most precious resource. These funds go towards programs that work to ensure safe water for our citizens and communities, and include programs such as individual and community water and sewer, water environmental reviews, and water planning, which includes assertion of water rights, quality, quantity, and riparian protection under the Secretary of Natural Resources. This next pie chart will give an overview of discretionary funds that focus on services to our citizens. It excludes general government expenses and shows the prioritization of education, community, and health services, as well as the investments made in other areas with tribal discretionary dollars. Now we will look at some employment figures for the FY18 budget. Here you see a 10-year trend analysis of FTE, or full-time employee counts. FY18's budget includes 3,893 FTEs. FTEs for the upcoming year remain relatively flat. This table gives 2 breakouts. The one on the left breaks out all employees by funding source. IHS Self-Governance funds the most with 1,832, with DHHS following in second with 417. The table on the right breaks them out by department. Not surprisingly, health is the largest department with 2,024 FTEs, and education services is second largest with 333. This table breaks out vacancies and new positions by department. The table on the left shows vacancies, which total 348. Health has the majority of 212, and Human Services has 20. On the right, we have new positions by department, and there are 12 new positions in this budget. This table is a payroll analysis, quantifying and explaining the impact of employment variances from FY18 from FY17. I will go down the list and give more information. The decrease in career services is related to correcting the budgeted hours for the forestry firefighters program to actual hours worked, as well as eliminating various vacant positions. The decrease in community services is due to eliminating vacant positions. The increase in the gaming commission is related to career ladder adjustments that occurred in FY17. The increase in government resources is due to the transfer in of real estate services, offset by IT employees being transferred out. The decrease in health services is due to the transfer of health IT employees to the Information Technology Department, offset by an increase in community health and Hastings employees. The increase in information technology is related to health IT transferring into the department, along with the departmental reorganization. The decrease in management resources is related to real estate services employees transferring to government resources. These changes sum to a total increase in payroll of approximately $2.4 million. That concludes my presentation. And I would like to take a moment to say thank you to a few people who helped significantly in this process. Connie Chandler, who's sitting on the side over here, she's our Director of Budgets and Financial Reporting. Jamie Cole, who you all know is our Controller. Chrissy Moore, our Financial Analyst. Galen Thompson, Janet Baker, Ramona Mays, and Daniel Stroop in the Budgets Office. And we have a lot of financial resources employees that pitch in during budget review, and I want to thank them. Stephanie Reamer in the Communications Department. She's a Vian native, and she does amazing presentations, as you can see. And all of the department executive directors and department budget staff, we cannot do this without them, so I want to thank them as well. I want to thank you, Tribal Council, for your time and for your attention today. I will try to answer any questions you might have, or I'll find the right person to do so. Thank you.
Okay, so at this point, if anybody has any general overall questions about the budget, you can direct them to Lacey. If not, they're going to be better answered by the department that you have the question about. So if anybody has any general questions, now's the time to ask. Otherwise, we will start with the Office of the Chief. Okay.
Y'all had a question.
Oh, go ahead.
Lacey,
All
get
right.
back to registration. Federal funding that
Yes.
was eliminated.
Yes. So, 2013, we were negotiating our indirect cost rate with our cognizant agency, the Department of the Interior, their Interior Business Center. And we, through the process of that negotiation, they flagged the registration department, and they said enrollment costs are not allowable in your indirect cost rate. And so we asked them for the authoritative language on that. And they pointed us to a Word document on our website that had a circular reference that called out election and enrollment costs. And they made these interpretations outside of what the Office of Management and Budget, what their circular says. And so we challenged the agency's extra interpretation of these costs and pointed to President Obama's requirement of all agencies to consult with tribes if they're going to make any changes in their interpretation, and they had not done that. And so we entered into singular negotiations with them. They agreed to keep it in our budget for a period of time while we completed negotiations and review, and they stayed their initial decision to eliminate these costs. But through this period, there were also other tribes that were including enrollment costs.
And you said how much was that?
So cumulatively, over 4 years, we've saved the nation $4.1 million simply by challenging their decision.
So now it's going to have to be picked up by.
That's true. Yes.
Okay, it's quite a blow, so I'm sure
It
there's going
is.
to be more coming. Okay, thank you.
Thank you.
Okay. Anything else before we start in? Okay. So who wants to do the Office of the Chief? And I guess my question is, after reviewing your books, do the counselors have any questions of the Office of the Chief, or are you okay with their budget as presented? If there's no question, we can move on to ours. Jody's here. Are there any questions regarding our budget?
Well, I'd like for him to go over it anyway.
Okay.
And we did add the 170 into this budget here on the community funds, correct?
Yes.
Okay.
Exhibit A.
We have, of course, we have 5 budgets under our direct control. The sports teams is $80,000. That remains the same. The Cherokee livestock auctions remains at $75,000. The general fund portion of the tribal council, like Speaker mentioned, we'll add back that $170,000 for community assistance. So it'll remain at $2.2 million. The local law enforcement right now is budgeted at $600,000. That's consistent with last year until we get those final numbers in, which will come later in the year. That'll get adjusted. The tribal council IDC portion is going up by $24,000. We've remained flat in that budget for several years, and just with increases in salaries and everything, I had to go ahead and increase that a little bit. I'd run out of room, taken away from general operating expenses to cover our salaries, so I had to increase it by $24,000. So total budget is going to be a little over about $4.1 million for the council.
You good, Harley?
Yeah, I think that's all of them. So you name community system, livestock, law enforcement,
Sports teams.
and
Yeah.
another one more?
We've got two budgets for just the tribal council, which is Gen Fund half and IDC half. So community assistance is within the general fund budget, tribal council.
Okay, thank you.
Jody, I have a question.
Councilor Shaw?
Is there any tribal assistance for emergencies for our at-large citizens? For example, I know Councilor Hatfield and I are deeply concerned about what's happening down in Texas. Is there any money available in community assistance for these at-large citizens?
You do have community assistance.
We do have.
Yes.
That monies are available for us to help our citizens down there. Okay. Would you please, would you mind emailing that to me to make sure I fully understand the amount of volume or the price or the cost that we have available to us to help our people down there?
Right. Okay.
I'd be grateful. Thank you.
Okay.
Okay. That brings us down to the Supreme Court's budget.
The only major change in the Supreme Court's budget is an increase in their space cost related to them moving upstairs.
Okay. The boards and commissions, you want to speak to that, Lacey?
There are no major changes to these budgets.
Brings us to the Attorney General's office.
There are no changes to this budget.
And then that brings us to Education Services. We do have, I saw Ron here earlier, I think he's hiding right now. If anybody has specific questions, he came loaded. Got Jennifer with him. And Dr. Borton's back there for backup, so. So does anybody have any questions regarding this budget? Okay, if not, you guys got up for nothing? I'm sure you have work to do. Oh, okay, go ahead, Wanda.
I was looking at your Head Start program, and did I read correctly that our Head Start teachers they're paid $20,000? Is that correct, or did I?
Part of it
That's
is
right.
split between the federal source and then
Okay.
the gen fund.
Okay.
Puts a
okay,
little bit
so
in there to bring them up
That's
to the state.
that's our portion of it.
Yes.
Okay. Okay. I was concerned that we weren't paying them well. Thank you so much. Thank you, Terry.
Anything else there? Okay, very good. Okay, health services. I know Connie was here earlier. I see Dr. Grimm and Amy both back there.
short chair there.
Yes,
Dr.
I'm
Bell.
just as tall as
Chair for long
everyone else.
legs. Okay, does anybody have any questions specific to the health budget?
At our pre-budget hearing committee, we budgeted this year, was it 6 million or 8 million less than the previous year overall? Do you remember, Lacey?
It is
8.6.
8.6.
8.6 million less.
But the largest driver of that is $6.7 million due to the transfer of the health IT budget to IT, sorry. We have a new executive CIO, which is now over both the government IT and health IT, so it's just, it's the primary decrease there is transferring that to his control. So you'll see that show up as an increase in the IT budgets.
Okay, I have another question, and I may be misinformed, so please correct me if I am. But are we about to receive, is it $8 million a year in grants that we had not received previously, starting this next year?
Are we receiving $8 million in the new grants?
Okay.
That we have not received previously?
Perhaps, is this upon the completion then of our new healthcare facility, that we're going to receive so much million a year for services?
That's complete, yes.
After, it's after it's complete. Thank you, Chief, I appreciate that. Okay, that's where I got that figure then. Is it 8 million a year?
80.
80 million a year. Oh, bigger figures, I like that. I like bigger figures. Thank you. 80 million after completion.
We're working hard.
Good, good. I want to ask a question. On pay raises in here, were there any pay raises in this budget? Because I didn't see them for our physicians.
When we had to turn this in back in April, May, we were not near completion of what we were going to do with pay raises. And so it's not in here, but we do have the funding available. Late in the year when the IHS budget was finalized in Congress and distributed by the agency, we received monies for pay act increases, population growth, inflation, and those are the monies that we will be putting into the pay raises. So we have the monies available, just waiting on final clearances.
Explain to me, final clearances from where?
We're almost through, I think. HR has, the chief's office has reviewed things, HR has, finance is or has looked at them, and I mean, we are very, very close to getting approval to move forward.
Now, is this going to be the pay raise, or are we talking about the RVUs?
It's going to have a component of RVUs in it as well, but it's also going to have an increase to the base, which was mentioned at the last Health Committee hearing by Secretary of State. So it will have both of those components.
Now, for example, can you give us a ballpark estimate of what you think that base raise will come up in percentage? I mean, we're talking about physicians without a raise, what, 5 years, 7 years?
I don't know the exact number of years that it's been. I should off the top of my head, but I don't. It's going to be a combination of things, and it's going to be different by category because of the new base pays that we are going to also set. One of the things that hasn't really been discussed is we are elevating the base pays of certain categories of providers to make it easier for us to recruit. That was one of the big issues. So anyone that's currently below that may get a different rate increase than somebody that is at or above that. So it's going to vary by provider type. So it's very hard to answer that question, with a single number. Whenever we have final approval of everything, we can go through by category and let the council know, what the overall rates were.
Can you give us, will it be at least equivalent to the cost of living for the last 5 years?
For some people, it's going to be a lot more than equivalent to the cost of living, and for others, maybe not. Like I said, it really depends by category. It is not an across the board percent for everybody sort of raise. And that's the way it was when we did it last time too. It varied by physician specialty type.
I don't know whether to ask you, Dr. Grimm, or Connie, who's back there, but are we anticipating the loss?
If she wants to take my seat, she's
Yes.
more than welcome.
Is it getting warm, Dr. Grimm?
Well, you're doing really good. Dr. Grimm, I appreciate, because you're doing a really good job, and I appreciate answers. Connie, do we anticipate the loss of any more physician positions?
We're not aware of any. I've asked the medical directors in all the clinics. We meet with them monthly to keep us apprised of anyone that they expect to leave, and we have not been made aware of any.
Okay, I guess I was concerned because I think it's approximately 20 physicians that either have left for personal reasons, contracts weren't renewed, or just decided this wasn't where they wanted to be. And I want to make sure that if we're going to lose any more, I guess my question to you is ultimately, how are we going to staff a 469,000 square foot facility when we're losing doctors at the rate that we're losing them?
Well, I would say that that number is incorrect, and I think you asked that last health committee, and I will get that exact number to you.
Yeah. Could we just request Human Resources to supply that information to us?
Councilwoman, I did a FOIA request to Mr. Hembry with those numbers, and I'll forward you that email with that FOIA request.
Okay, I
Yeah.
appreciate that.
Yeah.
Thank you very much. I guess I'm deeply concerned. We were in Jay, Oklahoma, and thank you for meeting us there. That made the tour so much more enjoyable, and it was a gorgeous facility. But I know Counselor Shambaugh and I were talking to you. There are only 2 full-time physicians and then 2 locum tenens seeing 7,000 patients a month in Jay.
Well, we have the mid-level nurse practitioners also there.
Okay, my question to you, is it possible that we're phasing out our physicians because we're going to replace them with PAs and nurse practitioners?
No, ma'am.
That is nowhere in any plan? And then next question, do we have a long-range plan that you work off of?
We do.
Would you mind forwarding me a copy of that so I can have a better comprehension of what we're doing now and then looking for the future? I would just be deeply concerned if we are replacing our physicians with, mid-level care and reducing the overall quality of care that our patients are going to receive. I mean, I want the best for the Cherokee citizens.
Yes, we do too.
And I can understand a nurse practitioner. My goodness, we employed a physician assistant for 10 years ourselves. And they're great within their capable skills. I just want to make sure we're not going to leave our people short by not having the right qualification person providing their medical care.
Yeah, and we would never want that either. And we try to have 2 mid-levels supervised by 1 provider. That's the model that seems to be a safe practice across the nation. And we watch that oversight very carefully. And if I may address a comment earlier, the providers now, there was a statement to the effect that they hadn't received a raise in some years. Every year, all providers are eligible for up to a 5% bonus of their base salary, and that's a pretty good significant bonus. So they do get some incentives.
What was the lowest incentive that was provided this last year? Do you know?
I couldn't tell you off the cuff like that.
Okay, because I thought you shared with us that it was right around 4% was the lowest you'd given.
I would never make that publicly because I don't have that information in front of me.
Okay. Can you tell me how many podiatrists are on staff with our medical facilities?
I'd have to get that information back to you.
Can you tell me approximately? Would 2 sound about right?
I would have to get that back to you.
Okay. I would appreciate that information. It would help me know whether or not I want to pursue with this. Do you know how many specialists we have in each area?
Like
Cardiologists, orthopedic surgeons? I mean, we don't know podiatry, so obstetricians,
I mean, we have over 250 providers in different specialties, so I'd like to just, if you could be specific about what specialty you're asking about.
Well, I'm really specific about podiatry because it's my understanding that we have less than 2, maybe 3 podiatrists full-time. And I'm deeply concerned because, again, it goes back to our diabetes. We have the highest prevalence of diabetics in America. And the fact that I'm deeply concerned about in specific podiatry care. I personally had an aunt that lost her life because she needed podiatry care and did not receive it. And she lost her foot gangrene set in and she died at a very young age. It's very, very important, and I don't know what the American Diabetes Association recommends on the care of podiatrists, but I bet if we researched it, we could find it's quite high. Who else is providing podiatry
I can
care?
assure you that we share that concern for podiatry, and being in, 40 years of type 1 diabetes myself and have a daughter who's diabetic, that we understand that very clearly. But we want people to be safe,
We do too.
and we will have safe podiatrists working for us when we continue those recruitment efforts.
Okay, I would appreciate those numbers, and I look forward to receiving those from you.
Okay, Counselor Lay?
Thank you, Madam Chairman. On the IT portion, I guess you're splitting those out of health over to what is a standard IT area. With that goes a lot of HIPAA work also. How's that going to be, how are you going to make sure that it's taken care of?
Sure.
We had a meeting last week, Health IT with Tribal IT, and all the people that would be involved in that sort of thing, our acquisitions people, our contracting people, from both sides, to make sure that should any contracts be put in place that would potentially risk patient, health information, sensitive information, that we have a process in place to know that we put a BAA, a Business Associate Agreement, in place that has the stricter language that you find in health type BAA agreements. And so we're right on top of trying to ensure that, this transfer doesn't cause any problems like that. And the fact is that most of our staff in health that we're doing the early contract preparation will now be in tribal IT, and will be very involved in the early phases of that document preparation. So we were concerned enough to have a meeting, but we're not, we wanted to just make sure everybody knew and understood, and I feel certain that we've worked that out now.
So is there a firewall and the personnel only limited to our health records, or is everybody in IT be able to get on their computer and get your health records? Or
No, they won't be able.
How does that work?
They won't be able to do that. You have to have a username and password to get into our health records. With this sort of transfer over there, what we were concerned about was if health didn't have total control of the contracting process, would there be some contracts that slipped through without this stricter BAA about protecting, health information? Say somebody came on site and their worker walked behind a computer screen that had health information on it. And so we need to make sure that anything that is even close to a risk of an outside entity being able to see or get a hold of because they're doing work on our health records, that sort of protected health information, they have this sort of an agreement in place. So,
an agreement with the employees?
with Cherokee Nation, when we bring them on as a vendor to do any sort of work for us.
Kind of keep us abreast of how that works out.
Okay.
That's an area that could get tricky.
And to make sure, I don't know if it's clear, but the health IT department will still do those health IT functions, and then I think the tribal complex will still do things that are separate from that. So it's kind of two different programs, but we're very confident in Jared Welch, the gentleman who's been put over that process. We've had great results working with him, and I don't anticipate any problems.
Okay, and I never really heard a definitive answer of how much the providers are getting paid. When do you spring that on us? Or are we gonna see that, or are we gonna pass the budget without ever knowing?
Yeah. The treasurer sent out a few questions last Friday, and I'm sure she understands it's a priority for us and the chief, and she'll be very responsive to
Well,
help
there's
us.
some priorities here with this council also,
For all of us.
not just the chief. So when do we have that answer? I'm looking for help here. Anybody want to answer that?
As soon as all the information is gathered, and plugged into the health system, and that information is ready to be disseminated, it'll be disseminated to the tribal council. Putting down an exact date on that is not warranted at this time. Just as soon as it gets done, it'll happen.
Well, and having a lawyer have to answer that question is a little scary to me, but that's okay. I'll accept it. I appreciate it, but I want that, I would like to have, we would like to have those numbers in generalities before we vote on a budget. Is that out of line to ask that, Madam Treasurer?
I mean, from my perspective, I did a first pass review on it last week. I sent my questions back to health and HR. So, I mean, they can answer their questions that I've sent to them and help me get a better understanding of what it is that we would even be bringing forward. If you had to ask me for a number right now today as to how much this is going to cost, I don't know, because they didn't give me all of the information that I need in order to be able to give you that. So before we bring it to the council, we need to make sure that that information is validated and quantified so that we understand what the impact is not only in this year, but in every year going forward.
I understand that. So we've been working on this for how long now, and we still don't have an answer? Right up to the moment, we're 1 month away from passing the 2018 budget.
I got the information last week, sir.
That's interesting. Thank you, ma'am.
You're welcome. Do we have any? Oh, I'm sorry.
I just, Dr. Grimm, you mentioned, what exactly is the intent of the 018 budget in terms of a provider bump, or is it across the board? You mentioned there might be various differences between disciplines across the board. I mean, what is actual, maybe the intent at least?
So the intent was to try to adjust all providers upward. Because even though Connie mentioned they had gotten these bonuses through the years, we were going to adjust base pays. The first time we came before council and we only talked about RVUs, because at that point in the year it didn't look like our revenue would support something in the middle of the year. Now it appears that our revenue is going to be on target. We got these additional monies from IHS. And so besides the RVU component to it, which we still would like to put in and plan to, there will be an increase to base. But it will vary by provider type, so it's hard to say. And there will be increase to bases of different provider types so that we feel like that we put ourselves in a good process or a good place for recruitment. The question was asked about, how are we going to recruit for all the positions that we'll have. These adjustments that we've made to the different bases are going to put us in a better place to be able to recruit as well. Be more market-based with those people around us.
Have we looked at how other tribes perhaps have utilized RVU model to compensate, since that would be comparable to our model? Other tribes, VA, see how they've worked RVU.
We've looked at some use RVUs and some do not.
So if we're going to go down that road, we need to see how it's functioning with other comparable
And the
models
goal,
of healthcare.
yes, absolutely. And the goal was to get our providers up to the MGMA data, which is the national database for provider salaries. And it has a good standard base pay that they should be making and how to incentivize them based on RVUs. And so we have studied that very diligently. And I think we're going to make some nice adjustments.
Thank you.
Kelly?
Jody's.
I did, Mr. Lay, Councilor Lay, one thing on as far as the health pay raises, it would have to come back to the council as mods in order to get those pay raises. So this part right here would just be the base salaries that they're at right now. So you would have its opportunity to review those increases in a budget mod before they went into effect. So.
And I appreciate that, Jody, but sometimes the budget mod is slapped down on my desk at the council house 2 minutes before I vote on it. I would prefer that not happen this time. Thank you, sir.
Thank you, Jody. Harley?
Just want to talk a little bit about providers and the old discerner system. I know that's not a popular name with me or some of the council members, but I've had reports from even providers that told me this, that they feel like that they're doing secretarial work when they enter data on the Cerner system. Is that because that's what we have to do to get by to the federal government or the tribal operations? Or who sets those standards for that?
CMS, Medicare.
Oh, Medicare system. And I've heard that as one of the obstacles for some of our providers, that they feel like that they're spending a lot of time doing secretarial work to put stuff into the Cerner system. And I was wondering if there's anything we can do to help that along and still be in compliance with medical.
I actually tasked Dr. Stallcup to develop a work group to go out and evaluate each provider in the clinics and just see what there is in the system that we can streamline to improve their efficiency and make it easier to navigate. But you could go to Talcott City, you could go to any St. Francis Hospital, and this is a complaint with all healthcare providers. I would struggle to go back into direct patient care. I don't know if Councilor Shaw has had the opportunity to try and work with an EHR, but it just seems like it'd be a nightmare because I'm used to grabbing a pen and writing down a note and it being done, and that's what providers are used to. The expectations of documentation in order to get paid have increased, and it's a meticulous job, and it's difficult. The relationship you have with your patient is different because you're so preoccupied sometimes making sure you get everything into that medical record, and it's a safety issue overall. So.
Well, that's one of the complaints that I've heard about the providers, about the new systems that we're using right now. The other thing is, I agree with Councilor Lay, we really need those numbers. We could actually move forward with the health budget, because we have talked about this for the last 6 or 7 months, and we should have some numbers ready for us to look at least preliminary numbers or ballpark numbers or something like that. So, I know I have a call from even providers, and that's their concern. It sounds like the base sound like it's going to be set. So we just need the raise part. That's what Councilor Lay is talking about. But anyway, those are some of the things that I'm hearing. That there's so much, and I guess if you got to do it, you got to do it. Hopefully we can work around the system and still stay legal within the system.
That's our goal, sir.
Thank you.
You're welcome. Councilor Walkenstick?
Connie, I was reading that FOIA request that we requested, and in the last 6 years, it's been 102 positions that were contracts were not renewed for whatever reason. And in the past years, it was 20. And the reason I say this is because I care about health. If I didn't care, I wouldn't say nothing about it. My concern is the new hospital on staffing it, and it is a popular conversation out in the communities that a lot of our people, they're short primary care. I guess when we transitioned to the Cerner, some people were waiting 6 months to a year to get a primary care physician, and that's a shortage of our physicians, and I guess we're going to the physician assistants to take up that load. I'm not sure. Is that what's happening, or is that going to happen?
We've always had physicians assistants. When I worked here as a new grad, we had PAs and nurse practitioners, so that's not anything new.
Well, I guess my question is, so are the physician assistants, are they going to be taking over the load on the absence of these physicians to take over folks that are needing primary care?
They do have some patients assigned,
okay.
Yes.
All right. That's good. As long as someone's there and is able to check up and follow up with these people.
The demand has increased over the years significantly.
Sure.
And then I had a meeting with the providers at Three Rivers last week. I think they've all been impaneled about 1,000 patients each. So, but they're limited by space. Even if we had 3 more doctors to go over there, there's probably not the space to do it at this time. So we're working on ways, I know
Well,
Hastings
recruitment.
has been working on getting all the patients on a wait list assigned, and they've cut that in half. And so.
Sure. No, I agree. The weight has decreased tremendously. That's, so back to the podiatrists, I talked to some folks in some different clinics, and they're concerned about not having a podiatrist on staff. What's the plan?
We have a plan to continue to recruit podiatry. We still have a surgical podiatrist at Hastings that can do those kinds of surgeries if needed. We have a referral base to send those patients out to a surgical podiatrist or another podiatrist if that's necessary.
So we're just contracting everything out, more or less? Or
No.
We're going to contract it out?
If we need to,
But right now, do we have any podiatrists on staff?
yes.
Okay. So I know. What do you say, Dr. Green?
4. We have 4 on budget.
Okay.
Where are those located, Dr. Grimm?
2 at Three Rivers, 2 at Hastings.
Now, these other clinics, are they going to share the workload with these 4 podiatrists?
Wilma P. gets one day a week. Vanita gets one day a week. And Owata gets one day a week of those Three Rivers podiatrists. So one of them is really 80% at Three Rivers. The other one's 60% at Three Rivers. And then they travel to those clinics. So we're trying to take the care to the patient instead of making the patient come to either Muskogee or Tahlequah to get that care. And we'll continue to try to do that. And we have plans to continue to try to do that when we get the new facility too. We'll get a bigger podiatry department than what we have right now as part of the staffing for that. And with a number of the specialists, if it makes sense, specialty by specialty, we'll try to do that to some of the outlying clinics instead of making everybody have to come to Tahlequah. But it depends on how many specialists we have and the type of care they do. And so I wouldn't say that 100% of the new kind of specialists we're going to get may be traveling around, but some of the departments will probably be able to do that.
Okay.
I do know that Dr. Baker has a podiatrist that he's recruiting to put on staff, and so we'll get it resolved as quickly as
So
possible.
we're gonna fill these 2 vacancies. That the 2 people we didn't renew the contract. We're gonna fill these 2 positions, or we're gonna consolidate with the 4?
No, we'll recruit for those vacancies.
Okay. That's what I was wanting to know.
Yeah.
Okay.
Why were their contracts
thank
not renewed, may I ask?
It's not in a public, it's inappropriate. We can talk to you in executive session, I believe. It's an HR issue.
It's an HR issue? Okay. I have a question. We have 2 podiatrists at Hastings. It is my understanding we have a podiatrist at Hastings who we cannot bill Medicare or Medicaid for. Am I incorrect?
You have to have supervision of their services until his Medicare billing privileges are reinstated.
And so who is supervising the podiatrist that we cannot bill Medicare or Medicaid for? So we're seeing
Those
him for
services,
free.
ma'am, are being billed for, and
Madam Chairman, when you talk about an employment issue in the realm of specificality where the person is readily identifiable, that is a matter that should be discussed either in executive session or offline. I think we are getting into that area, so I would ask that this conversation about that individual be conducted
Okay.
offline.
Then let me word my question. Is it possible we have people doing services that we cannot bill Medicare or Medicaid for on staff?
it's possible, of course.
Are there more than one person that this is happening to? I mean, I'd like to know. I mean, if we're doing services, I think we need to be billed for these services.
Well, I think you need to remember that the majority of the patients we see do not have a payer source anyway. And so that would not be something that we would consider whether the patient would get care or not.
No, but I think that if a patient didn't, if we're seeing a patient who probably does qualify for Medicaid and Medicaid, it's just that the provider doesn't qualify to receive payment for us to be reimbursed by, why are we using this person?
So that they can get seen. They're supervised.
Well, I'm just saying there are plenty of physicians, I would think, out there that we could employ where we could be paid, compensated. I think that's important.
We would love to do that.
We agree, we want people, I don't know that I couldn't answer that directly right now because we have, again, 250 to keep up with. And, that includes our behavioral health staff. They have to maintain licensure and CEUs. We just had to suspend someone because they let their license lapse. So it's a constant, I'm not trying to avoid answering your question, but I don't want to be accused of lying to you if something has changed in the last 24 or 48 hours. I want to give you accurate information.
Okay. Perhaps at our next healthcare committee or before our next healthcare committee, you could make that information available to me on how that's working. I'd be grateful.
Okay.
Okay, I want to give everybody, since this is our biggest budget, our biggest concern for most of us, Counselor Austin, do you have any questions pertaining to the budget for the healthcare?
No, I'm satisfied that,
Okay. Counselor Crittenden?
I'm just curious, like talking about the base pay raises. It sounds like a lot of people have been in on that conversation, a lot of different departments. And I've thought this for a while. I thought at last committee meeting, when I come into the council, the old timers say, you control the purse strings, purse strings, purse strings. It seems like we're getting out of the loop here on this. Seems like a lot of people have been in on the conversation of the base pay raises, and we're just kind of just waiting on you to throw us a bone and let us in on it. And that's my feelings of that discussion. So I'm like Councilor Buzzard and Councilor Lay and probably a lot of folks. When those numbers do come available, we have to answer to the folks, and we'd like a little time to discuss that. Hey, is this good enough? And be able to come to the council meeting with confidence and which way we're going to go.
Okay. Counselor Warner?
Yes, ma'am.
Have
Thank
anything
you.
to add?
I think, from my standpoint of view, I think we've identified a lot of issues now, and I feel certain that we're going to identify those solutions. That's my main goal, is to focus on what is that solution. Just one thing that I want to throw out there, recently in our community, I know the Cherokee Nation, thank you Connie and everybody that's helped working on the local hospital. It's now Northeast Health System, Sequoia. Recently they decided to, something about the amount of money they get back from Blue Cross Blue Shield of Oklahoma. People that have that insurance, they're no longer going to be on that network. So that may affect us. It may be into the positive, it may be a negative. I know it's going to mean a big load of patients coming in. We have 19,000, probably more the charts than that at Redbird Health Center. So just something to be mindful of, and I know you guys work, with Cherokee Nation Health Partners. We're right in there close on that. So just keep that in mind. If anything you see that I can help, whatever, just let me know. Thank you.
Counselor Jordan, do you have anything to add to the discussion? Junior?
No, right now it's very interesting, but it's.
Okay. Counselor Shambaugh?
I won't make a comment.
Counselor Vasquez?
I'm satisfied.
Okay. Counselor Hatfield?
With my perspective, it's a little bit different. Work with the at-large population, but in the same sense I work with all Cherokees. But that seems to be the largest issue in the at-large community. I think it's just throughout the United States. That is probably my number one phone call, email that I receive. And in the private sector, which I use, physicians' assistants and nurses practitioners they're being utilized all the time, more and more, because there is a problem recruiting doctors and health professionals. There is a problem, and because of the shortage, I have a cousin that helps recruit doctors in Texas, and it's a very, very serious situation. So I commend you and thank you for, doing the best you can, because, it's just a very big concern, but I have been very pleased with my work with Connie and her staff when I do receive a call from a citizen outside the Cherokee Nation. I've been, there are times you can assist those people. They have to come to our clinics. They have to, or we refer them to an Indian Health Service clinic nearby. And that's a situation our Cherokees outside the jurisdiction are up against but we do have the Indian Health Services. The majority of the tribes outside the Cherokee Nation are willing to work with me always. Just, I haven't had a situation yet with any of our citizens that I haven't been able to assist that citizen in any way if they are not able to visit one of our clinics. So a different perspective, but yet it's the same need when you're dealing with our Cherokee citizens. And we're obviously a very large population, but thank you. Thank you. Chair.
Councilor England?
Yes, thank you, Madam Chair. And I agree with my colleagues on the other side of the room and one here. So thank you guys for putting this budget together. And I really feel like I do use the No Water Clinic, so I do use our health system so they can build my community care and Medicare and all that. And but I'm in there and I see these people, and then a lot of my constituents use the Oshaleta Clinic, and so I hear from them also. So I know our providers, they was dependent on this rate. I mean, I really think they was and to come to this budget hearing and not hear that going to happen, we're going to go back out into our areas and we're going to hear about it. So I'm having a hard time supporting the budget right now, because I was hoping it would be whole, but it sounds like it's going to come later. I think we can hold your feet to the fire, that it will happen, and I think you guys won't let us down. So when we go out and we tell these providers at the clinics in my area, I don't know anything about the others, but I know in my area that we can say, we're on board with you, and we're going to help you get what you deserve, because you're keeping us alive. So, but anyway, for that reason, I would support it just so we can keep things moving. But I would hope that you come back very, very soon and tell us that you're going to help us out and help us with our constituents.
Yes, sir.
Because
We
that's
all
the
want the
people
same
that hire
thing.
us.
Yes, sir.
So I'm
Good comment.
I get one.
You already?
We just get one question apiece.
Till everybody else gets to talk.
Yeah,
Okay.
everybody
Okay.
has their opportunity.
Okay.
Councilor Byrd, did you have something?
Yes, just, I saw, maybe you explained it earlier, this is a decrease in domestic violence against women there. Is that something that we talked about? And second is that, our treasurer talked about receiving the data a week ago. When the data is all discussed between the health department, the HR, and the treasurer and the chief on these providers and for our people out there, give us enough time, Jody, that, like Councilor Lay said, we have to do a budget mod. We don't want that in front of us that day. When we get information that day and you guys are in a hurry for lack of whatever, then it kind of makes us suspicious. Why are we trying to expedite this so fast? If it's for a grant, there's a deadline, yes, we'll jump all over it. But if it's just somebody wanted to get it passed that day, that night, that doesn't hold water on this end. So if we're going to do a budget mod, and we're going to have that discussion on the providers and primary care, give us ample time, because we may want to call a special meeting before we do anything. And it does come back before us, correct? Okay. Well, I use Hastings Hospital myself. My 3 children were born there, and I'm proud of that hospital. And I hope once we get it completed, when we get the $80 million per year, it will give us some leverage to hire the people that we need to take care of our medical staff, because I know it's very difficult to hire these medical people, and we have to contract out sometimes, but we need to, we need to get that moving, because healthcare, you have close to 2,000 employees, and it's a big deal. That's our number one concern out there is healthcare. And that seems to be the chief's initiative, but we need to communicate a little bit better right now. We've got people doing good things, but we're not sharing the information for us to make a good decision on this end here on the budget. Thank you, Madam Chair.
Okay.
Thank you, Denise. I was also looking at the substance abuse. It was kept 1.2 million. I didn't get my answer. And I know that's a priority in this area in Cherokee County. What are the repercussions of that cut?
That's our Jack Brown Health, or our Jack Brown Center.
Is that Jack Brown Center?
Yes, and the reason that there's a decrease is we had some carryover from their construction project. Well, when we constructed the building, the Health Services loaned them some money, so to speak, for the construction of that building, and they were able to repay that to us in FY17 through their third-party collections, and so that's why their budget was inflated in FY17 to budget those carryover funds, and those were transferred over to health, and then, but their operational budget has remained the same.
Okay.
They haven't had to cut to their operations.
All right, so you guys don't foresee any cuts in substance? Okay. All right, thank you. Thank you.
Okay.
I have a follow-up question.
Go ahead.
It's like, we're scheduled for 2 or 3 days for budget hearing today. And I just wish that each person on this council, if they have a question, to ask it. It pertains to budget, but I think this is a good time to get some of the stuff out that you want to ask. And I know I've been in the same shoes as this group has as a director here, and it's a trying thing to try to meet all demands, but I think they're trying. But there are just some things, Connie, that I feel like people want to ask, but they don't ask. I don't want them to feel like they're rushed in this budget hearing to move on to the next session, because we're scheduled here for 2 or 3 days, and it seems to me like a good time to talk about health issues. And I just want to bring up mental health. We've talked about the clinic in jail. I actually had someone come out and look at it as far as that part of the health system goes. I just wish that the Cherokee Nation would be the one to put it in, but I'm happy to have anybody in that building that pertains to mental health, because that's really a problem here within the nation, not only here, but throughout the United States. So I'm happy it's moving in some kind of direction up there, but we've got days to talk about stuff like this, and I think everybody here wants to help. I don't think we're here to question you and make you be on the defensive part all the time. I certainly don't want to be that way. I want to be there to, if I bring something up that maybe it's not the most popular thing, it's not meant to put you down or try to make you be defensive. It's to be constructive criticism about what we're doing. And I know when I worked here, I was always appreciative of people telling me that stuff, because a lot of things you don't know. Just like Dr. Graham. I know we didn't have podiatrists at J Clinic, and I don't know why we didn't have one on, say, 1 day a week up there, but we didn't. Salina wasn't mentioned, and I guess it kind of goes back to the overall who's taking care of this, who's watching out for that, and I don't know if it's the directors at those clinics that should be requesting those things, or whose job it is, but it's just. And I know you guys have got a big operation. Sometimes you just can't see it. Doctors and service. I don't know, Connie, you can't administrative other duties to do, but somebody needs to be there to bring those. And I bring this to you today because I'm not criticizing you. I'm just telling you that we don't have one there. And I'd like to get the people up there like that involved. But anyway, I don't know, just feel like we're trying to rush health to get them out there or not. Because, we've got scheduled 2 or 3 days to talk about problems. And I think what we're hearing from other people is just constructive stuff, and not to put you on the defense to try to say, well, you're not doing this, you're not doing that. You're trying. So I appreciate the fact that you did bring this budget to us. And I think we've heard, and I think you've heard, that there's things that we want to have more of. So I think it's a good time to discuss it and not just go by and pass the budget in an hour. So anyway, that's my right.
I
Thank you
appreciate
for
that,
being here.
and I hope we don't sound defensive. I think what we
Yes.
want to do, I think everyone in this room agrees with what we
Yes,
want.
I agree.
We want the best health care and all services offered to all of our constituents, regardless of where they live. We want that as well. We're having to operate with another flat budget, and we're doing the best we can with those resources to maintain operations and the high quality of care that we want to give our providers or our patients. And I think as long as our revenue continues with the trend that it is, it may be later in the year, we can look at adding positions, enhancing services in other areas where they're not available. We have a plan for podiatry that we'll put forward to you guys, and to not only replace the vacancies that we have, but enhance services to some of the patients out there that may not have the access that others do.
Yeah.
And we appreciate the support of this committee. I mean, you guys help us a lot.
Thank you. Thank you, Madam Chair.
You're welcome. Counselor Lane had a follow-up.
Thank you, Madam Chair. I'm still short one physician at Oshaleta. I'm still short one physician at Nowata. And it's my understanding, and you guys correct me if I'm wrong, I should be short 2 physicians at Nowata, but we melded in some PAs and MPs, and they're doing a good job. I don't want to send them back. We've also got a doctor out of Salina who now oversees Salina, Nowata, and Oshaleta. And we'll keep him if Salina doesn't want him back.
I want him back.
All right. I did have something happen at Oshaleta. We had an electrical problem in the dental area.
Yes.
And because we couldn't get an electrician, apparently what I was told, we couldn't get an electrician until this week up there to figure out the problems. And I'm understanding we sent our staff to Veneta. And for the life of me, I can't, on something like that, we can't get an electrician quicker than, 5 days, I think, to a clinic facility where we have several, we got a dentist and several staff members working there. We have to send them to another clinic to roll them over temporarily until we get the electricity figured out. I don't understand that. When Hard Rock electricity went down, they all went crazy and threw resources at it, right and left, to get it back up. I'm sorry, I mean, I know gaming's important to us, but a clinic is just as important. And so, I don't know who was responsible for saying, oh, it's okay, we'll wait till next Tuesday to get an electrician. But I'm gonna tell Chuck and Victoria, and I've already told Chuck, I want that staff back as soon as possible. And that's a little bit in jest. But I want them back as soon as possible, and I wanna know who's responsible for waiting that long to call an electrician to go up there. We could have had CNCR folks, they didn't know about that, by the way. That may be something left over from the construction of the building. Apparently there's been problems before. So I'm a little upset and just letting you all know. Thank you.
Counselor Shambaugh.
Well, you said something that I was waiting for you to say about the recruitment of more doctors and more staff. So I know at Salina, I talk to people who try to get appointments there, and they have a 2-month wait. So obviously there's a shortage of doctors to see these people.
Because Dick took our doctor.
We'll get to you in a minute. I know, I have a friend who's was an ER doctor in Northwest Arkansas, and there was 28 ER doctors at this hospital, and they brought them all in one day, and they let go 26 of them, and they replaced them all with physician's assistants and different things to try to save money. Well, that didn't work. Obviously now they're getting all the people back in the system, and yeah, physician assistants have their place. Obviously, you have those cases where they can, and it's a good way to get people funneled through, but people don't, who are sick don't want to see a physician assistant. I know you don't get to pick and choose what you get, but it's very important to have those people on staff, like more than one doctor. I would see that it would be overwhelming, especially we go to Jay and they see 7,000 a month, and I know that there's a ton of people who are diabetics, and we don't have anybody who are talking to them about how they're eating and different things like that at Salina or Jay. I think that's a major issue that needs to be addressed in those two facilities. But also, it's putting a lot of stress on that one doctor there to see those kind of patients all day long, just him or her. That's a lot of stress, and I think that's a 2-month wait is unacceptable to a lot of people. But again, you're talking about people who can't afford gas money or might not even have a car to go to another facility. That they have to hitch a ride to get where they're going. So it's tough for people to go to Hastings at time, or even Salina from Jay, or vice versa. So I think that's one of the biggest issues in my district is it just takes so long to be seen, because there's not enough staff to see me. Is there anything? What can you do to attract more physicians or even?
I think the new base will be a huge improvement in our recruitment efforts. It will help us a lot. And, we have a brand new health facility. Just the physical environment and that alone, once we can get a doc here and let them see and meet the people, then we usually can recruit them. I was at an event this weekend and we were watching the fight. And we had 3 of the people there were residents that had graduated through our OSU program and are now leadership programs with the Cherokee Nation. That shows that we are being successful with that kind of partnership, the OSU residency. In 2 years, we'll have the medical school here, and we'll get our first pick, like we do now, of the best, training, working alongside our providers, developing the relationship with the providers and with our patients. If you talk to those residents that have come out and gained employment with us, that's what it is. It's the relationship. They love the way we take care of our people. You don't have to send them across the road for an x-ray or send them down the street for radiology or lab services. We do everything in one-stop shopping. It's better than Walmart for healthcare because you can get everything you need at that place. You don't have to go across town to get your drugs at the pharmacy. It's all in one building. It's a beautiful model, but there are a lot of moving parts to that, and I think we're putting in places so that long-term, when we are recruiting for the new facility, we're going to be working with education and with HR, starting meetings probably in the next 2 months with an organized effort to get out and recruit our high school kids, get them redirected. We do an Operation Orange with OSU every year that brings in high school kids and lets them touch real body parts and see what it's like. But there's a lot of support services that are needed. So we're working on these things. And I think we're just at the ground of changing healthcare again for what we've done for our citizens over the past several years.
I might add too that, we're going to be approaching IHS as it gets closer to time too. They have a scholarship and a loan repayment program. We try very hard to get our sites to be eligible for the loan repayment programs that are out there, both National Health Service Corps and Indian Health Service, but we're going to approach them since we'll be the first tribe in the nation to really help operate a medical college, to see if they might be willing to set aside, and we would probably enlist your help and the chiefs and our government relations people and our lobbyists to, as we get closer, maybe see if they can guarantee, if Indian Health Service would guarantee a certain number of scholarships, to students, to Indian students going to this college. If they do that, then those students have a payback as well. So that if we don't get them, and we hope we would, somewhere around Indian country would get those, new physicians whenever they graduate. So we'll be working, on that front too. So we're going to work with a lot of partners, as Connie said. And the other thing I would just add is there's a primary care physician shortage nationwide. Oklahoma's, not in good shape. Our state legislature this year, and as they have in past years, sort of grappled with, there was a bill that came up to allow nurse practitioners to have independent practice, so that there wouldn't be necessarily any physician oversight. Well, there would, but they could still set up a private practice. And so, you know, it is a problem getting physicians into rural Oklahoma, and we do think we do a really good job of, you know, recruiting. We are not 100% full, and we have turnover, but we're working very hard every day, you know, on different aspects to try to get all those positions filled.
Good, Mike?
Yes.
Councilor Wilkinson?
Dr. Grimm, appreciate the short-term recruitment plan, and Connie, appreciate the long-term recruitment plan. You know, I think Councilman Shambaugh, he's probably wants something right now. I'm sure you guys are going to find a solution and hear some of those issues. But you know, let's go back prior to this recruitment. You know, it sounds to me we have a high turnover rate, and if there's such a shortage with primary care, we need to be more diligent in trying to keep our doctors. You know, I don't know what that looks like, but maybe more rounds of golf. I don't know, but we need to find a way to keep these docs in our clinics. You know, but anyway, so you guys kind of hear the whole grand scheme of things here. My next question is with the Cerner on the IT on that, on the technical assistance, what budget is that under? For
The Cerner cost?
Yes. Well, not,
It remains in health. It's,
is it the IT? Or
yes.
The 3.5 million?
Yes.
So you guys anticipate those costs for this type of technical assistance for Cerner this year?
Yes.
Okay. All right. Thank you. Thank you.
I would just add, those are not all technical assistance costs. Some of those are, you know, licensure payments and things like that. We have to have how many people are on the system at any one time and things like that. They're ongoing costs that we, you know, knew that we would have and anticipated, and there's always things that we can't anticipate, but that's not all technical assistance sort of costs. I just want you to know that.
Thank you, Dr. Grimm. Thank you, Chair.
Councilor Warner?
Yes, ma'am. Thank you. A question I was thinking about, Dr. Graham hit on the point that it's a nationwide shortage that we're looking at. You know, and like Councilor Walkingstick said, you know, how do we keep the docs that we have? But I think that, I mean, from my understanding, this is just me, as I drive down the road and I hear, you know, advertisements for Mercy, Integris, and all those things. Now that we've evolved as our healthcare, we have started to overlap into those areas. And when you overlap into there, you're in a new battleground, and we're all battling for the same thing, the docs that aren't there. So, and one thing that we need to remember with our recruitment and all those things, just coming from a college standpoint of view, what I do this year, the fruits of my labor from that year, I don't get to see until 2 or 3 years later. You know, I mean, and so when you're looking at recruiting the docs, and we need to keep that in mind, that I know it's a 4-year program, but you're still looking at 5 to 6 years to see what type of fruit do we get out of that labor. So, I mean, and what we have, you know, it's a labor of love that we do for our citizens and everything right now. So that's just something to be mindful of, and that's just kind of how I see it. Thank you.
Councilor Shaw, did you have something to add?
Yes, I just had a question. Do we have do we have an equation on how many patients perhaps, or what classification of patients our nurse practitioners and our PAs are seeing versus our physicians? Because when I did the math just based upon the J Clinic, they're doing 7,000 patients. You take out the weekends, you know, we're talking about, I think it was 22 days I came up with. And then you divide that by the 6 main providers, and we're talking about how many patients they are supervising. I think I came up per day, and then plus they're overseeing our nurse practitioners and our PAs. I was curious as to what the breakdown, how many what is the criteria that a PA or nurse practitioner sees a patient instead of an MD or a DO?
Let me first clarify the number. The patient visits includes dental visits, optometry, lab only, or radiology. So that doesn't mean a true patient visit with a doctor.
Thank you.
So to answer the question was, how do we determine who goes to primary? We try to, based on acuity as much as we can. The more acute, we try to make sure they see a primary care, and then try to utilize mid-levels for unscheduled things. They have appointments, but we try to schedule them, but have room for walk-ins of that. It's a model of care to where you have a doc and a mid-level that kind of sees a team of patients.
I guess, so we have like a triage person that decides whether or not you're going to see the doctor or a nurse or a PA, is that it in our clinics?
Yes, there's protocols and policies.
And I've understood that triage thing is working better at Hastings in the emergency room now.
It is, thank you.
And may I ask, who is doing the triage? Is it a physician or is it a nurse?
We have an RN that's been trained in triage several times. And then when we have a high influx of patients, we have a provider come up front, and they may see the patient at the same time they're being triaged, and what they call treat and street them right there, do exactly that. So that's been very effective, and our left without being seen rate going from 10% when we started to under 3% for the last 3 months now.
Good. Well, I'd heard that it was doing really well. And the next thing, I guess, is when you're scheduling all these appointments, how you break it down. I mean, can you enlighten me on how, when people schedule so many appointments, how you break it down? Is there a percentage that you basically know, well, 20% of these are going to be seen by these people, and or do we need to bring in locum tenens today? Because I know that you said there were 2 locum tenens out of J.
To be quite honest with you, all the docs kind of practice a different way, and we're trying to get them all aligned with at least something very close to a consistent practice, so you don't have, like the drop-in clinic at Stillwell is a beautiful model. It's like an urgent care there.
Okay.
So you have one provider that sees a lot of the walk-ins that don't have an established provider there, and so we like that. And we'd like to do that more in other clinics because it's very effective for patient access.
Straighten up.
Good, thank you.
Okay. On to health. I think our next health meeting's going to be probably you probably have some good news for us by that time. Get a little bit closer to.
We sure hope so, guys.
This worked out. So
We'll find something else to.
Connie,
we appreciate it.
Were you talking about the Meriwether fight or the one on Main Street?
The Mayweather.
Hey, Chairperson.
Yes.
What's the process if we want to make an amendment in a budget?
Okay, so we're asking you to keep track of that, and we've got somebody from finance back there that will, everything has to balance.
Sure,
And so
sure.
if we want to add $40 million in
Takes
health,
away
we
from
got to
something
take
else.
$40 million somewhere else. And so we're going to do all of those. Once we've gone through all the departments, we're going to do all of those and give finance a little bit of time to figure out how to make it all work. So make you a little note.
Okay, all right, thank you.
Okay? All right. I think we can move on. We appreciate you guys.
Thank you.
So our next one is community services. Oh, yes, I'm sorry, financial services. Have got, it got hidden behind everything else.
Happy to take any questions you have on budgets underneath financial resources.
You got anything? Okay, if nobody's got any, we'll move on to community services. Thank you, Lacey. Sure we'll see you again.
And then if we adjust.
We're moving into book 2 now. And we've got the best of the best from community services right there. our roads, our water. Any questions about those budgets that you all may have? And if there's anything else, not roads and water that they can't answer, Lacey may be able to, or they can take it back. Yes, Councilor Walkinston.
Hey, Billy, I was trying to get hold of you yesterday evening. Environmental health, the administration, the cut, the $1 million cut, what was that? No, sorry. No, sorry. I apologize. It's 742,000 increase.
Yes.
Yes. Can you kind of add to that?
Primarily what that is an anticipation and carryover funds that we're going to have next year.
Okay.
And plus, we've been doing some work for Gary's group as far as drilling wells, for the new construction homes, and we hadn't budgeted that previously. So a lot of that is wells that we're going to be drilling for Gary's group, and then he's going to be reimbursing us for.
Okay. How are we on getting caught up with all the water and sanitation? I know we got behind because we was waiting on the IHS money. Where are we at? Are we getting caught up, or?
Yes. Now that we've got our money in, we've got 3 contractors working full time. We've got our force account crews working full time, getting those caught up.
Okay. Good. Thank you, Bill. Thank you.
No other questions for this bunch? Okay.
There's one.
Oh, I'm sorry, Harley.
Really, I noticed on the individual water and sewer, your budget is $33,555 less than last year. Tell me, that's the one we use to drill wells, septic tanks, drain fields and stuff?
Yes, we do that and we also do like repairs for our elders and for disabled folks. And because the folks who are getting MAP or getting the HOSDA funds, we cannot use IHS money. So if someone's getting a MAP trailer and they need a septic system or a well, we use those tribal funds to drill those as well. Now, the reason there was a decrease, I believe our budget last year, the initial budget was $600,000, and we got a small increase through the mid-year carryover. And so this is back to what the initial budget was last year, $600,000.
On the community water and sewer project stuff, is it same budget as it was last year?
Yes.
Do you have any money that you're going to be carrying over in that budget?
We don't anticipate any right now. We will pretty much have it all spent by the end of the year.
And then on the individual water and sewer from the IHS, now, was it increased this year once you finally got the funds?
Yes, it was a small increase over last year.
What about on the administrative side of that budget? You had a larger increase?
Well, we won't know until we get our last funding from IHS for the fiscal year, and then we do our year-end close and compare it to last year's.
Okay.
I think we're anticipating that it will be slightly more than last year, but until we actually get those numbers, we won't know for sure.
Okay. And then roads, I guess, Michael, on roads, I didn't see any big changes in the roads program at all. I think I'd asked Jody about I think there was $171 million budgeted, but then you explained to me there was another budget that still comes in from the DOI that wasn't, it was included, it didn't show up. The reason I didn't see it. So is that always going to be there, the DOI portion of that?
The DOI funding is I call residual funding from when we were under that compact.
Okay.
Once those DOI funds are expended on the projects that they were set aside for, that money won't come back. It'll just all be under the DOT or Federal Highway budget.
Okay. So that'll be gone?
Yes.
Okay.
Eventually.
I didn't see that, and I know there was like $10 million that I didn't see. Okay, and then I take it that your administrative budget is still taken out of construction funds?
Yes, sir. For Federal Highway and DOI both, yes.
Okay.
That is correct.
And that's all right, but Lacey, that's something that I wish we could pursue more. Every other program, almost every other program in the nation gets administrative funds. Road programs, like since I was in there, that we have to take construction budget, which we're really supposed to be using to build roads, and make an administrative budget out of that thing. So I know we get interest dollars from those interest money because there's like, I don't know, $71 million in that account. I'm just wondering why we can't use some of that money. to do an administrative budget instead of using the construction fund. So that's something I wish we'd take a look at. I know your administrative budget is what, $500,000?
Yeah.
It's
Well,
probably some,
I mean, we don't do an administrative budget because it's all in construction, but.
I mean, but it's used for administration.
It is used for
It's used for
administration.
administration.
Yes, yes. I could look and see what we
Well,
spent.
that's something which we look at, but I just hate to use construction money when we should be using some administrative money, but we don't get administrative money for our roads. So,
And you're saying that other tribes do?
I don't know how other tribes do it. I take other tribes, Michael may know, I guess other tribes take it from construction funds.
I don't know the answer to that.
There's a lot of them that's not compacted fully like Cherokee Nation is to federal highway, so I don't know. I don't know how to say. But anyway, that's always been a sore throat for me ever since the road program was here, that we take it out of construction funds. But anyway, that's just something I want to bring forward. Thank you.
More. Councilor Rockenstein?
With the, so Billy, you mentioned that you guys are anticipating doing some new construction homes for water and sanitation. How many of those homes are you anticipating?
We provide the well drilling services for the homes Gary's building that need wells. So I don't really have that number. Gary may know how many homes are coming up that.
How many did you budget into your FY18 budget?
I think we put in well drilling for probably about 25.
25 homes?
That will need wells. It won't be able to be connected to public water, but they'll need wells. So I think based on what we've done the last couple of years for Gary's group, that was an average number of what we've drilled, around 25 wells.
Is that, I guess, that's probably a Gary question, but I hope we're going to build more than 25 homes next year.
Well, that's just the ones that are getting wells. Most of the homes are, they're connected to public water.
Do we
do that because we have a contract with the well driller.
Yeah.
And Gary doesn't. So he uses our group to drill the wells for those homes. We have an interdepartmental agreement with the Housing Authority. And we just wanted to make sure we included those
Do
expenditures.
you hook
in
up
our
to the
budget.
main water source? Your department, do you guys assist in helping out like with a water meter or something like that? If it's hooking up to rural water?
If it's through Gary's group, Gary's group handles all that.
Oh, do they? Okay.
Yes,
All
other
right.
than the well drilling.
Okay. Sounds good. All right, thank you.
You bet.
Thanks, sir.
Did you exceed that 25 last year?
No, I think that's right where we were at. We were right at about 25.
Anything else?
I have a comment, Madam
Okay,
Chair.
go ahead.
On the Indian roads, it says 1.74 decrease. Did you explain that, please?
Yeah, those are the DOI funds that Councilor Buzzard was referring to. Those funds are not reoccurring. When we entered into a program agreement with Federal Highway Administration, those are the old DOI funds that we got under the previous compacts. They've just been
phased out?
Continuing to be, it's phased out, yes, sir. It's continuing to be budgeted, but once those projects are built and those dollars are spent, it will go away. That budget will cease to exist.
Okay. What are you anticipating on this President's proposal on our roads money?
I've been asked that quite a bit. I like to think that infrastructure is a priority. It seemed to be talking about it quite a bit across the United States. How Indian programs will fare is kind of remains to be seen. I know a big focus is infrastructure. So I'm hopeful, and I don't foresee, I haven't heard of any major decreases or anything, but I'm hopeful that we at least stay level.
Okay. Thank you, Madam Chair.
You're welcome. Any other questions? Okay. Go back and do your thing. We are going to deviate just a minute. Linda O'Leary, because there was a change in her budget, we're going to go ahead and if you have any questions for the registration department, we're going to let her go ahead and answer those.
Good morning, Council.
Good morning.
Do you want me to decide questions or?
Go ahead and anything you need to tell us or
What tab is she under in here?
14.
Volume 2?
Yes. Government resources.
Yes, I'd like, Linda, would you explain the different source of funding we had to switch over to in registration?
Yes, I do. I have that in front of me right now.
The treasurer did that, but I think just
Yes.
for, the total
Yes, she
council,
did.
we'd like to hear that again.
Okay. For our 2018 budget, in our registration gen fund, we have like 857,000, right at 858,000. And our registration IDC, which was cut, $330,198. That's where our shortfall is on that. Our registration governance is 856,000 plus. Our photo ID, what we're allowing right now in that budget is 70,000 for a total 2018 budget of $1,784,258. So what we have actually been reduced, our photo ID staff has 4 staff members, and we have the iTech person, which is Randy Alberti. In the future, my understanding is, and I know that Lacey and her group have worked diligently and very hard to maintain the indirect cost, but anyway, the powers that be didn't allow us that 330,000. So now, in the future, what we could do is we can renegotiate that IDC Fed fund. So that's kind of where we're at right now. Now, we can operate within that budget. I don't anticipate having to do a budget mod. We'll have to see what the future holds as far as our travel and things of that nature.
Basically, when we say powers to be would not allow us to
Yeah, I'd like to
discuss,
make a
would you explain
clarification.
that?
Oh, I'm sorry.
She's not being reduced, I mean, by this budget. Yes, you see a reduction here.
Yes.
What's happening is those employees that are associated with that $330,000, those are IT employees.
Yes.
And so those are being reallocated to the IT department. She's still getting full use of those same employees
Okay.
for database maintenance and IT-related projects. So I apologize if there was any misunderstanding here, but there's not been a true reduction to this.
Well, let me clarify too, that in this budget, that my assistant and I worked on, the other assistant registrar, Jamie Cole helped us diligently in preparing this. And that's what Lacey's speaking about, is how it's shown here. But on our form, it is shown as a minus, but we still do have access to those services directed toward us.
Thanks for clarifying that. Thank you, Madam Chair.
Sorry about that.
Counselor Anglin?
Yeah, thank you. So this won't hinder you from going out with your photo IDs to all the communities like you do now?
We still are going out to the communities, and I'm going to be very honest and upfront with you, because I always am. We are going to be traveling less to the out-of-state, probably half of what we've been traveling, until we're told otherwise. And so, yeah, I want to make that very clear, because that's exactly where we're at on that.
Because I know I like for you coming into our areas. 'Cause
Yes,
that helps people.
we'll still be doing a lot of, most of the in-district within the 14 counties. What we're going to be limited to is the out-of-state travel, which would be half of what we're traveling right now, until we're told otherwise. We were just advised that. And so I want to make no mistake in misleading this council, because that's not what I'm about. I want to tell you what we're going to be doing and what our obligations are. Then I will say for a fact, and whoever likes it, they don't, they don't. We still are short on our photo ID staff. We have 4 employees and 1 IT guy, and we are short, and that's just the truth of it.
Linda,
What? Sorry. I can put you down after Counselor Lay.
thank you.
Thank you, Madam Chair. Linda, I'm just now hearing the IT, so you're, and help me here a little bit understand, are they shifting to another department, some of your folks, or?
We have had a few transfers for more money, and we have had, we were looking at our overall budget, because we've not been increased that much, to be honest with you. So our staff is down to 4 and 1 ITech person, and it's just the way it is for right now. Now, what we've been doing, being honest with this council, we've been borrowing from our other divisions, our citizenship, and our CDIB staff to help us. And the thing that we can do that right now for, that's not really hurting us, is we are, as I presented to this council the last time I appeared before you, we are totally caught up as of a year ago last July
Good job.
with the new way we did it. So that enables us to borrow from those other divisions or department, not a department, but within our citizenship and CDIB people.
And we're proud of you for catching that up.
Oh, that's a first, and I'm gonna take credit for that. Me and my staff. Now, we're gonna take credit for that one, because we have worked hard and long, overtime, weekends. We're not complaining, don't get me wrong. We like to service our people, but the fact remains we're totally caught up, and it's a first within this, in registration, and by golly, we're gonna holler it and toot it.
Yeah.
You know, so.
One of the things that, when I hear that your staff is shifting, is, to me, registration has to be a body unto itself. We don't just want everybody waltzing in and waltzing out and having access to the registration database and all that stuff that goes with that.
Yes.
So are you still feel confident that you've got that in-house?
We do, and we're very mindful of acknowledging that confidentiality and keeping our safe. We're only certain ones that have authority and permission to enter it, because that's one of our BIA regulations. You know, we don't want to violate any of that. When the chief asked me to come down here, he said, as I've told you all, the chief said keep it legal, and that's what we've done in all aspects. And in serving our people, we've still been able to help them. We are actually, and Councilman England, you spoke to this, in going out in the field and going out to the other states. We have a tremendous amount, and when I say we borrow from the others, like CDIB or citizenship, we are needing to do that because we have a person that takes in the applications on the spot at that time. We can even do the photo IDs knowing that we've got, we haven't certified them, we haven't given them a number, but we know of the lineage because we can look back on our computers. And we can say, okay, we're going to take this photo ID for you now, and then when we get back, and within 2 weeks, it's going to be processed, depending on when I'm there to sign it, and it goes out, and we mail that blue card or plastic card to those individuals.
And the vault. We've had some leakages and problems down through the years, not just since you've been here, even before that.
Right.
Do we need a new vault?
We need a new vault, and it is my understanding that that's hopefully forthcoming very soon. We are actually, to be truthful with this council, we're going to be out of room in about 1.5 years or less. And we have reorganized, we have refiled, we have scanned, we have done all the things that we need to do in order to have more space in the vault, but that is where we're at. And as some of you all weren't here the last time that I mentioned this, we still do have the tremendous amount of intake applications that come into our office. And as unbelievable as it is, we still have that 1,200 to 1,500 new applications a month, okay? And so we're keeping up with that. We're keeping up with all the other responsibilities that we have. We're looking at the scholarships and signing those, and the feather request and all of that. And we have just one person on our fax machine, because say you don't have your card, you go to the clinic and we have to verify, yes, you're eligible, you can treat them or whatever, admit them. And so we still have all of those responsibilities. That hasn't slowed down. But yet, working together, and we're not working as much overtime now, which helps our budget, okay? But we have done a lot of that in the past that gets us to the place where we're at today. And by the way, I'm going to tell this. Chief got, a year ago, he got a standing ovation because we were caught up in registration in Seattle and...
I got the credit that
day. In Seattle and Portland.
Yeah. So when are we going to budget for your new vault?
Well, I haven't been...
It'll take a while to build it.
Huh?
It'll take a while to build it.
It will, I think, I don't know if Secretary of State wants to speak to that. I think he has more information about that than I do. But that is forthcoming and in the works, right, Chief?
It's not being presented in this budget, but we are mindful that we need results and we have a plan to work on.
Thank you.
Okay.
All right, Counselor Shaw.
Yes, Linda, you said that the travel budget had been cut in half. Just as a question, I guess Counselor Happ and I both would be interested in, does that mean that you will be attending to half of the communities, or you will be sending half of your staff to all of the communities?
We will be attending half of those out of state. I'll be very honest with you. I don't know how long that's going to happen, because our at-large people are going to be clamoring, I want you there. And I mean, I'm just being honest with you. And I just don't know how long that will last. And then that may change at any time, to be honest with you. I don't know. But for now, we have traveled, as you know, every month. And cutting that in half will help with that and things of that nature. I just don't know how long it's going to last, because, like I said, our at-large communities are going to be probably wanting us there, and everybody knows it.
Counselor Vasquez?
Yes.
Counselor Vasquez has the floor.
Sorry, I was on the list first. Lacey, I wanted to make sure that this is clear to us, that in registration, employees have not been lost or changed. They're simply being paid from another source. Is that correct? So it's seamless?
Yes.
Okay, thank you. Just want to make sure. Thank you, Madam Chair.
Okay, now, Harlan.
Yeah, Linda, have we did any, we looked at doing registration different by mail? Is there any way you can do that by mail? To get people registered by mail?
Not really, Councilman.
Photo ID, you can't, nothing we can.
No, because in the photo ID, you sign the signature pad, and we were there to verify you are who you are. By mail, it would lead to a lot of confusion. It would lead to a lot of people not being honest about their relatives or their lineage back. And we don't see those people, but we do at photo ID. And when we do the intake, there's certain paperwork that we have to do, such as affidavits. Are you truly the father? Are you truly the guardian? And that all comes under the purview, because the BIA allows us to determine our own blood quantum. Very important. We're the only, as I have said, we're the only nation in the United States of tribes that the BIA allows us to do that. We don't want to violate anything that would put that in jeopardy. So therefore, we have the affidavits and we have the paperwork. Now, the paperwork that you see that the people fill out, that's not real lengthy, because we're only going back 2 generations, where before we type back, as I have told you all, to the original ancestry. But in saying that, we can verify that and proceed with it, you know, and it's all still legal. So therefore, if we did anything by paper trail, it's just not verifiable for us. And then, like I said, we have the other affidavits that follows up for the verification of you are who you are, here's your ancestries. We use death certificates, we use affidavits of biological parents and things of that nature. So there's certain things. And in the aspect of that, you know, we've got an instruction sheet on the front of our application. But we always have 15 questions, even we think that instruction sheet's clear. It's not clear to everybody. And we're repeating a lot of things that they need to do. So the mail route would be useful, but it's not accurate, it's not reliable, it's not, the integrity of it's not there.
Well, I could see that, and I know we've been doing this for a while, and you'd think at some point in time, whereas you might see 300 at some meeting like that, that the numbers may decrease and maybe only see 100. Or maybe it may get to the point of where you're traveling, you only see 10. So I don't know if it's ever going to get that way or not. It doesn't seem like it.
With the intake of what we have, you know, we used to, now what we have applying, we've got grandparents, parents, and children. Everybody wants to be Indian anymore, as you well know. So we have this influx of that. And of course, we have the new births, you know, and things of that nature. And the people that maybe, my kid needs scholarship money, so I'm just now going to apply and see if they're eligible. And a lot of times they are. And so we have that influx of it. I will tell you that within the tribe, I know it's not your question, but we have over 355,000 in the tribe. And I'm gonna brag on registration again. It's not any more important than the other divisions, I'm not saying that. But it all starts right there, as far as the eligibility, as far as getting money from at the federal level, and our number count, and we are the biggest tribe in the United States. The next tribe would be the Navajos, and then on down. And as I said again, I want to regurgitate and remind you that we are the only tribe that the Bureau of Indian Affairs allows us to determine our own blood quantum. The other tribes will prepare the paperwork, they'll send it in to the Bureau of Indian Affairs, someone from the Bureau of Indian Affairs signs that eligibility, okay? Here with the nation, we got 2 authentic Cherokees that sign their forms, and it's the chief and myself. You know,
And I
do
think
that.
it's a good deal.
That's something to be very proud of as Cherokees.
Well, it's just, it seemed like that, everybody's prepared a flat budget again this year. And I know the photo ID is, it's nice to have, but it's not a requirement.
No, it's not.
You have to have it. And we're spending a lot of money for going out with you and your staff, to me, just to take a picture. Because they could do all this other stuff by mail if they really wanted to prove they're Indian, but a lot of them, I think, go just because they want the picture on there, and it's costing the tribe a lot of money. Not only you, but when we take the chief and his entourage with it, I don't know how much money it costs. There's a lot of people here in our 14-county area that could use some of those funds that are being spent for the entourage that follows you out to these places like that.
And I understand what you're saying, but I also understand this. We do have our brothers and sisters out of state. That is sometimes their only connection back to the tribe. And I'm going to tell you, in our travels, and we've been everywhere, okay, those people, our Cherokee relatives and friends and family, are very, very proud to have that card. Because what we were doing, we were replacing the CDIB cards originally and the blue cards all the time. Maybe Susie washed husband's pants 2 times and the card's gone. This plastic card, it seems like that when you carry it and it's durable, they will maintain it, they will carry it, they have it when they need it. And as I have said before, we travel with that card to every airport. It is honored, okay? So that back in their connection and them wanting that card so bad, as well as our 14 county district people do too. That is very important. It is something they are so proud of. What we saw when we first was traveling, and I've been down here 5 years this last July, what we saw was a lot of older people, maybe people in their 20s, coming and getting the cards. And like I said, we're doing the intake now when we're taking in their CDIB applications and stuff when we're traveling. And we're also giving out a lot of applications because they're going to send them in to us later. And that's not only the photo ID and traveling, that's the other services as far as the citizenship and the CDIB that we are able to assist them with there. They have learned now that we have scanners that we carry with us, that once they bring in their information, we don't have to, as savings in one point, we don't have to mail that birth certificate back. We scan it. Everybody says, oh, that's an original. Will you lose it? Will you this? No, we're not going to lose it. We don't. But they're on site. We do the scanning. And we have it. We can return that to them. We can say, well, you don't have to mail in these forms. We're going to take it in for you. Therefore, all we're going to mail back to you is your photo ID card or something. And that card is, it is so extremely important to our people outside our district.
Well, I'm sure it is. And it's not that I don't want services out there, but it just seems like there's an extreme amount of money being spent on those trips. That's my point. And I think it's good that we have interaction with our people out there, because there's some of them that really doesn't think we're still living in teepees.
And I tell you what, they are.
But what I'm getting at is, I think some of that could be done by internet, or it could be done by other means. Instead of taking 20 people out there and buying 20 airplane tickets, 20 hotel rooms, paying 20 people per diem a day, you could do all that stuff run out of a studio here and get the same thing done. Now, your part, I don't know that. You pretty explain yours to why it couldn't be done.
Yeah, and like I said, the confidentiality and getting everything regulated that way. But I will say, and as I was saying a while ago, now, and the last few years, people are bringing their entire family, the babies, the little ones, and getting their photo IDs done. If you could just see the look on those people's faces when they get that card, and when the little ones even get it, they must think it's driver's license or something because they're so proud that.
I think the service you're doing is good. I don't have a problem with that. Some of the other people that go, that's what I'm thinking about. I know they need to have the education. I agree with that. It just looked to me like we could do some other
They
things.
still feel, in us going out of the districts, they still feel, they have so much pride wanting to be Cherokee and wanting to relate to the tribe, that card to them is better than a credit card, even though they're not going to use it maybe all the time. But they are so proud of that, and it's something for us to be proud of. And as I've said, Chief jumped through loops and hoops to get it approved, and we know all about that. And that card is usable. Now, it's not a passport or anything like that, but it is everywhere we fly. And people get into a situation at the airports, oh, well, does my driver's license work? Does my this work? Well, by golly, our cards work, and we can go anywhere we want to with it. Yeah.
Okay, thank you.
Councilor Shaw?
I would like to say there is a plus to our tribal ID cards because they don't expire and your driver's license will. If you ever try to get on a plane with an expired driver's license, you can't get on. But with our tribal ID, there is no expiration date. And I'd also like to share this. I know that there have been several counselors who have verbalized concern about the cost. I want to share with you, when our chief needs something passed and he needs the votes, it's very easy to pick up the phone and call a senator, I'm sure, and say, hey, I have 25,000 Cherokees out in the state of California in your district. We need your support on this bill, which leads to more federal funding and grants to Cherokee Nation. So I have to fight for this. Absolutely, I have to fight for this. And I just want to make you aware that there's other things than just us going out and sharing a little culture and registering Cherokees. It's what that means to us as a tribe. Am I correct, Chief?
I think yeah. And Harley, we ran across, was it your brother out in Oregon?
Yeah. Well, not actually my brother's wife.
But we've been well received, and they like it. And I will say one more thing, unless you have any questions. The black stripe on the back of that card is for future reference when we develop it to show what services has been received and the request. So we have future use for that also.
Good.
Councilor Hatfield?
I've been traveling with the at-large population for 2 years, and the staff that we take, I say we, I'm using that loosely, is pretty minimal.
Mm-hmm. Very.
It's pretty minimal.
Very. We work.
Our registration staff works from the minute they get there to they leave, and the lines are out the door sometime. It is the photo ID is probably the most important thing that we can give them. It's probably basically one of the only things we can give them. They're very proud of that. I did hear someone use it as passport. One person, someone suggested that they, I don't know if it's Mexico or Canada, but anyway, that, and I understand, I understand the service that we need to give to our 14 county jurisdiction, but also I met with many of our constituents in the at-large population, and they basically want just communication, just a connection, and we find that all the time, relatives that are from this area. I fall in the same category. I'm an at-large citizen, so, and I'm lucky. I live in Oklahoma. But I feel like that our community culture organization, Rob Daugherty, I think he had to cut his staff back, and so I understand
the expense of traveling. You know, our travel expenses, I think, are public record. I don't, to my knowledge, no one has abused that. But I don't keep up with everybody else. I keep up with mine. And you try to find the best airfares. You try to find the best rental. Hertz car rental was astronomical. I'll be quite honest, in Washington. It's off the charts. But that's just the car rental I choose. But it is very important that we continue to recognize our Cherokees outside the 14-county area, because that, number one, that's what you walk. That's what you identify with. And I think many times they don't have the opportunity to do that. And sometimes the card is the validation, and it is good use. But I want to reiterate that Linda takes minimal staff, okay? And Rob Darty, I don't know, but I think probably so. But his staff is, it's phenomenal. We take phenomenal people out, outstanding people, outstanding artists. Maybe we could improve. I don't know. That's not my area. It's not my choice to make. But I feel like that in this position, I've been blessed to do that, and that is my job. To converse, to take care of our at-large population to the best of our knowledge. 255,000, that's a big group. But anyway, I want to commend Linda.
Thank you so much.
And occasionally we have several of our counselors from the 14-county area travel with us. And I think you see firsthand, and what we're doing in those. And I think it's very important. Yes, our priority is the 14-county area, but I think it's very important that we continue to bring programs. And I'm a little disheartened about, the trap, and hopefully we can work something out with you. Thank you, Chairman.
Thank you.
Stick.
Linda, I know this question already been asked, but what is that budget when you go to at large? What are you anticipating travel-wise and cost of staff hourly?
That will vary. It will vary on where we go. It will vary on the cost of the hotels and expenses that we ensue. And I don't have any of that in front of me, but it will tremendously vary.
But did you say it was going to be cut in half?
What we're cutting in half, let me be plain about this, is we're taking, instead of going to all of the at-large meetings, we're going to go to probably 6 of the at-large meetings, out of state.
Okay.
And
Now,
like I said,
Which is really 12.
Yeah.
So
Yeah.
there's
Two
Yeah.
different, 2 days.
Yeah.
okay. So here, I don't know. They're just being a lot of. Is there going to be a way for those other 6 communities that they're going to be able to get a card, photo ID, if we're cutting this in
we're
half?
supposed to pick those up within the next year. The next year, we're supposed to pick them up.
So like the next year, you're going to go out there
We would
instead
go
of the
to
other
those
6?
that we
Okay.
didn't pick up this year of 2018, unless that changes.
Okay.
And as I have told our Secretary of State, I anticipate it changing, but I'm not, I don't know, because we are real important to those at-large communities. That's just my opinion, and we'll have to see where we go with that.
Yeah. So what does, you probably don't know this answer, but an at-large citizen, what do they bring to the Cherokee Nation financially?
Well, they come home to vote. They come home for holidays. If you're talking about,
like bringing revenue into the tribe, what do they bring in besides the vote?
I really don't know on that part. I'm not privy to really know. I do know that they use the cards to go to their facilities in their communities and things of that nature. I know they use the cards for identification except at the banks.
The AG's got something to say.
Okay.
Madam Chairman, if I may, well, first of all, I think it's very important to state that every Cherokee is valuable regardless of where they reside. You know, my parents and I'm from Greasy. We're no more Cherokee than the Cherokees that are in Oregon, California, Texas, etc. But as to, I guess, to a monetary equation, if you wanted to break it down to that, what's important is to know the demographics of your tribe. As Ms. O'Leary stated, we are the largest Native American tribe in the nation. And as Councilor Baker-Shaw just stated, it's very important when you walk into a congressional office and say, these Cherokees are your constituents too. You know, here are a representative from California, and you have 600 Cherokees in that congressional district. That gets their attention. Now, can you quantify that? Sometimes you can, sometimes you can't. But what's important is that we tell, for instance, the California representatives that there are more Cherokees in California than there are any other tribe in their state. Those type of information, that type of demographics, that type of outreach, it's extremely important to the Cherokee Nation, and I know that it will continue in that same regard.
That's a good opinion, Todd.
And I might add that when we're out and we're taking in these new applications from our people at large, when we make them a Cherokee citizen, we also have to be mindful that we get federal money on that, on each Indian that we increase in our tribe. If you were to talk about monetary, what's bringing into the tribe, our numbers count and mean something at the federal level.
Yeah, at NCAI,
as far as housing, as far as, you know, whatever.
Yeah.
So when you're talking about monetary, it's not just the first thing you think of. It has an effect to bring in money to the tribe.
I understand the cultural value that we bring to our at-large people and what they bring to us, and but you know, my thing is you know, traveling at large. If there's an alternative method to reach these at-large constituents, whether it be a webcast for State of the Nation for the chief, or if there's a I don't know, just trying to find some alternative ways to save dollars. You know, Councilman Baker, Jack Baker, he said that a lot of his constituents would rather have the money in their communities versus us going up there and playing flutes and saying OCO to them.
You know,
that's what Councilman Baker said.
And somebody else could probably speak to the cultural presentation, but us being there, they have a connection of who they really are, where they come from. They're extremely proud of that.
Sure.
And in like Councilor Hatfield said, they only get that card, maybe. Maybe they don't get anything else unless they come back here and need medical out there, or they come back here and choose to, you know, have need medical services. And so it's a form of pride, yes, and it's a form of recognition, and it's a form of where did you come from? Do you have that Cherokee heart? Because what I've seen when I'm out there, I'm on soapbox now.
Yeah, I got you.
Forgive me,
You're okay.
but
You're good.
they got that Cherokee heart. Okay?
Yeah.
That we need to respect what their ancestry is, what ours is. As a chief has said a number of times, we are from one fire. And we need to honor those people and respect them and do whatever little bit we can for them.
Okay. Hey, Jody, did the travel budget for these at-large meetings, has that number decreased quite a bit, or has it stayed pretty much the same across the board?
I'd have to look into it further, Steve.
Okay, can you get that answered and get back with us?
That'd be the chief's budget, Counselor.
I think he's Secretary of State, I believe, with the travel.
He falls under the chief. Jody covers the council.
No, I'm not talking about the council budget, I'm talking about the
Large
the
travel.
at-large meetings.
Yeah,
Yeah.
that's cheap. Lacey would know that.
Lacey? Is, that, the travel for these at-large meetings, is it staying the same, is it decreasing?
I just want to make sure, because I want to make sure I got the context of your question here. So you're asking me about
The travel for the at-large meetings.
the travel for the at-large meetings,
It's
specific
one-
for the registration department?
No,
In general.
in general.
I'm
Does
not aware
that-
of.
Does that come out of the chief's budget or the secretary's budget?
It comes out of the individual budgets for which the individuals are traveling.
Like CCO?
Right, so it's gonna come out of their budget. So
That's
I've
our
not,
Secretary of State's budget.
I've not studied any of their individual budgets to see how they've
Allocate.
budgeted their travel. So I don't know that off the top of my head for those budgets, but I know for Linda's budget, it's a $25,000 reduction. So going from $109,000 to $84,000. So there's still a significant portion of Linda's travel available, just a $25,000 reduction.
Okay. All right, well,
And that's simply to help alleviate some of the general fund need, because we are having to take this program on and use discretionary dollars now. And I realize that $25,000 is probably going to impact a few communities, and I'm hoping that there's ways that, we can meet needs in other ways, but I feel like that's an insignificant portion
yeah. Well,
of this budget.
I respect both these at-large councilmen. I don't want to take anything away. I just see the cost that's attached to this, and if there's other ways, if bringing services to those folks is one thing, but if we can save costs through State of the Nation or something like that, I would recommend that. But anyways, that's my opinion. So whatever that's worth. So thank you, Chair.
Okay, Counselor Shaw.
Yes, I wanted to go back. First off, I want to say that when we are on the road, and by the way, I just got sworn in, but I have actually had the opportunity to go to a few of the at-large meetings while while I was campaigning, I suppose, although I was not allowed to campaign at these events. I want to say that. Never was I even once introduced. But I do want to say the hardest working person in the room is Linda. There is no doubt.
So much.
But the other thing I want to say is you all had the exact same travel budget that Wanda and I shared. The exact same dollars. Although we have to go all over the country to visit with our constituents, and you all can go down the street. But I want to invite you to use some of those travel funds to attend one of our at-large events and see what's happening. And then you'll see what we're all so excited about and why we are fighting for every dime we can get for our at-large communities. I mean, these people are craving our culture, our heritage, and they do crave those cards. They are they walk around with a certain amount of respect. They walk a little higher when they're holding that card, and they're so proud. But I want to invite every one of you to use your travel budget and come out and visit one of us at our large meetings.
I have. I enjoy it. I truly enjoy it.
Thank you very much.
I'd also like to interject that one thing that when we're at these gatherings, and some of the people already have their cards, but they're back at our meetings again, and they're inviting more people to join their organizations. So there's other pluses to it. And those people, they don't just hi, bye, see you later. Maybe just a very few. They sit, they visit, they meet their relatives. They meet the other Cherokees there. The little kids are doing the arts and crafts, and they're so proud of all of that. And it's not just a come and go kind of thing. They stay to the last minute. I know, because we're the last ones that leave the building, And so it's other things that connects our Cherokee Nation to our other Cherokees in the outer areas. And they're very proud. We're very proud to be there to serve them.
Counselor Austin.
Yes, I did go to the Washington, Oregon. It's the first large event I've gone to. And One of the things that really struck me about that, I sat and visited with hundreds of the people from Washington, Oregon. And I'd ask where they lived. Of course, I didn't know where the towns was. But then I'd ask how far they drove this morning. 3 hours, 4 hours, 5 hours. And I realized that the yearn to be connected, for them to invest 4 and 5 hours into coming,
Spend the money.
to set in the community of folks to have a meal. Because a lot of them already had the cards. They were coming to be able to sit in a community of Cherokee people that day. And they would sit all day long and participate in every event that was happening. I would expect that our per citizen expenditure for our at-large is a very, very small amount compared to our per citizen expenditure for our in-district. I was in my conversation with one of the elder gentlemen there that had driven 5 hours. I realized I can step out my front door at my house and I can look and see 5 Cherokee homes, 5 houses where there's Cherokee families live in them, visible from my yard.
Yes.
I can go to Walmart and guarantee you that 1 out of every 4 or 5 people I bump into is a Cherokee citizen. I can't go any place in my district where I'm not communing with Cherokees. I don't have to go 5 hours. These people have invested a tremendous amount to come to these meetings themselves, and I honor that very much. And I see the value in the meetings, and I think it's probably an investment worth us keeping.
And one of the things that I see in the people is they are so proud of their heritage. Even the ones that can't prove they're Cherokee, but they know they're Cherokee. Look at this picture. My aunt had high cheekbones. I'm getting to her. And all of that. We see all that too. And for the ones, as you all know, we have thousands and thousands, thousands and thousands of Cherokees that didn't get the land base, that didn't settle here, that came across the Trail of Tears, settled somewhere else, or the ones that didn't come on to Oklahoma, to get the land base. So therefore, we meet some of those people. They just want to be there because they know they're Cherokee, even though we can't certify them. They're there. And, to be on my soapbox again. But as a Cherokee Nation, don't we have a lot of money that goes out the door?
Yes.
Not running down the administration, I'm not saying that. Whether it be in food products, whether it be in something else, we have a lot of money that goes out the door. As I said on this council, I know, I was chair of executive finance. I know what comes in. I know what went out. But if we can't manage to service our at-large people because they are Indian too, they're kin to us, then I don't know.
Okay, we've got some other people that have questions, but I want to make an announcement to the other directors that are in the room. As soon as we finish with our questions with Linda, we're going to break for lunch, and we'll come back at 12:15. So I appreciate your patience. So, Councilor Austin, were you done? Mm-hmm. Okay, Councilor Crittenden is next.
Good to see you, Linda, and hear you. This comment's not directed at registration or at-large. You guys have a job to do. And the pride that those people have, it's priceless.
It is.
And the word travel, if you visited with me at all, that always comes up. Travel, travel, travel. Where it leaves a bad taste in my mouth. I'm not just talking about at large. I mean, there's a lot of travel. And where it hits home to me is, just the basics like we all get. We get, hey, I need water. Hey, I need a hot water heater. Hey, I need a refrigerator, air conditioner, help on my rent. And, when you hit a roadblock with that, the basic needs, these 14 county, of course, that their pride is kind of hurt too when they may not have water or something. But that's the bad taste that leaves in my mouth is when there's just not a pot of money for that, Sean. Then I look up at the sky and there's pots of money, not just at large, there's good and all, but I firmly believe there's a lot of unnecessary travel. Necessary, but I believe there's unnecessary too. So the people I've spoken with about travel, they'll know what I'm talking about. Just, I have a hard time with that unnecessary travel. And again, one last time, when I have that phone call where I can't produce any help for them. And so that's my frustration with the conversation about travel.
And with the Cherokee Nations, it's not an endless bucket of money.
Right.
We know that there's cuts. We know it's in
Exactly.
medical. We know certain times maybe you don't want to get sick in August.
Right.
You know, and it's just the way it is, and
But I
we
think-
try to overcome it and try to do what we can. And I think the nation's done a wonderful job.
And I-
We've come a long way.
I wanna
But I
thank-
still know there's never going to be what we can actually want to do for our
You
people.
betcha. And I thank Counselor Buzzard for bringing that up, and again, a lot of good and all of that stuff, but that's where it hits home to me, is that phone call where I can't produce something. And I turned down tickets to go to Hawaii one time to talk about housing. And I've got a lot of people that can see the sun through their roof, and, that's what comes to mind, things like that. Thank you for bringing that up, Council. Thank you.
Counselor Hatfield?
I think this is a good discussion because I think there are a lot of questions about the at-large community, at-large counselors, exactly what we do. And I'm glad we're discussing this, but when I receive calls from my constituents, I say mine, they have the same issues. They have the same issues. They have, their, hot water tanks, the health, right now I'm working with a gentleman, and I won't say what area, who is having problems with water. He's had it for several years. I've called Cherokee Nation. He's outside the jurisdiction. I've called Oklahoma City. I've made, I would say 25 to 30 calls, but I'm trying to resolve this because I think I can, and I will. But I think that it is good we have this discussion, and I think it's also great that we utilize our national treasures, which our national treasures are very important to our tribe. They're very important. Our artists are, they travel with us, and I think it's important that we take, that they're there. And I think that's all I think that's all that we have. Tommy, Robert Lewis, Betty Frog, Noel Grayson. I mean, everybody knows about those people. And so I think even with the discussion with National Treasures, that I think that they are being utilized. I don't know if that's the right word, but in our at-large communities, and they're well accepted and very happy. So. I would hope that we would use other national treasures in the future, but and that's one thing Linda brought up was the people that are involved when Robert is there with the storytelling, or with our Pam Bakke, or Tommy, that are involved. They love it. They eat it up because that is the connection, and that's the number one thing that they want. It's just connection.
And they come the next year.
Yes.
And the other thing is when our chief is making his speech, and he's made some tremendous speeches at our community meetings and at our at-large meetings, and he tells those folks what we're doing here for our people in our 14-county district in Oklahoma. You can see them straighten up, starting to really listen, give big hand claps. They're so proud of what the nation's doing for our people at home, their relatives, their interest. Or maybe they want to tell you, I haven't been back home for 25 years, but I come from down there, somebody mentioned Greasy. Or I came from so-and-so. Well, do you know so-and-so? There is that camaraderie and say, oh yeah, I know them. Oh yes, I remember that family. And there's just that pride that swells within these organizations. And that's there. And it's just a source of pride for them. That's great.
Hey, anything else?
Where's Marshall Buell at? Is he here, Secretary?
He goes see
just here.
with some emergency management.
You want to tell what Marshall is wanting to do, Secretary?
Marshall may need to get his presentation done soon. He's, as always, when national emergencies come up, his folks are talking to folks in Houston to see if there's any resources that can be brought to bear down there. So he needs to be on call, but let me see if we can get him. I know he wants to present his budget and then get back to that.
Thank you, Linda. That was
All right, thank you.
great.
Appreciate all of you.
I announced that, but I thought now Marshall Buell was going to present. We have something to say.
And this, yeah, that's fine. One thing that I'll go ahead and tell you, Marshall Buell mentioned to me in the hallway a while ago, is that because healthcare is such a big issue for all of us, that next year we might have them on their own day or half a day. And then we wouldn't have these folks sitting back in the gallery.
Yeah.
I think we could keep that in mind, Madam Chairman.
Well, I had instructed the first 7 budgets show up this morning, and then to watch as the budgets came up. So there was no reason for somebody that's number 15 on the list to have been here at 9 in the morning.
I understand.
If they chose to be here, that's their business.
Get a box of popcorn, right?
Yeah.
Speaker, Madam Chair, Marshall will be here in about, he's in less than 10 minutes, so he could present very soon, so.
So what does the group want to do? Our lunch is ready, and I had instructed everybody to be back at 12:15. Do we want to go ahead and break and eat? Okay.
Does Marshall Buell have anyone that could present if we take a lunch break? He doesn't have to be here because you just told us what he's wanting to do.
Yes, he does.
Okay. We do have some of us that put the budget for this. Okay, they're getting ready to break it. Okay. Yes. Okay. The marshal will be back at 12:15, but he is taking care of those,
Good deal.
Okay. Sounds good. We're adjourned till 12:15.
Was it really? Oh, gosh.